Well, parades are a place where many families and children, they come to have fun. But yesterday's deadly shooting in Highland Park left so many parents and so many caregivers not only shaken themselves, but of course for their children too, so traumatized by what they witnessed.
And that is why we want to bring in Dr. Firuza Aliyeva. She is a child and adolescent psychiatrist with Plena Mind Center, Northbrook. One area of her expertise is talking to children after tragedy. So thank you so much for being with us this morning, Dr. A.
First, we want to talk about yesterday. Mugo and I were live as we talked to witnesses. They had their children with them, many times 3, 4, 5 years old, and they had to rush to safety. Can you talk about now how to approach talking to your children about tragedy?
Hi. First of all, thank you very much for having me here today, and I hope you and your families are well today. So it's so important for us to have this conversation. I would say there are few points that are very important for every parent to remember when they talk with their kids. First, be present and listen. It's very important. It's also give simple answers, short and simple answers. This works the best with the younger kids, and it also makes sense to our teens and twins when, information is overwhelming. There's so many things going on. They're exposed to all media and other resources. So short, simple answers. Very important, let your children know that you're there for them. Watch for signs and symptoms of trauma. Kids could be traumatized, not necessarily being at the scene of this horrible tragedy, but hear about it as well. And very important, I would say last but not least, I think parents has to take care of themselves. They absolutely must honor their feelings. Kids are very sensitive. We may be brave in front of them, but if we're not well, they sense it. So the entire family must take care of themselves, and parents and kids.
So thank you, Dr. A. We know there were a lot of kids at the parade yesterday. We heard from parents and witnesses who say, they had a 2-year-old, a 3-year-old, and even a 5-year-old. Some of those kids are really young. So should you even bring up a tragedy like this if they don't ask you? And also, do you happen to have any sample scripts that maybe parents can use when talking to their children about something like this?
So there is no one simple answer. It's parents really need to understand their kids and see, they have intuitively, they know their children way better than any professionals around them. However, according to American Psychiatric Association, it is not recommended to bring this conversation to kids 8 years of age or younger, unless there is a risk for a child to be exposed to this information. So in this situation, it's at parents' discretion whether they want to explain things. Kids who were at the scene, it's very important to talk through short, simple answers and concentrate on the positive. When kids are very young, I would say until 8 or younger, it's important to focus on heroes, what happened. So it's important to create a story for a child that makes child feel safe. Usually what happens during trauma, our brain gets stuck on that extremely fearful scene and doesn't want to see the outcome. The outcome for those kids are they're safe, parents are safe. It's important to concentrate on the positive. It's important to concentrate that help is always available and they will be safe. For all the kids, twins and teens, I would suggest probably to have more in-depth conversation. For kids who are seeing all those scary pictures on the social media, really try to, substitute with something, again, positive. be a parent. Don't let kids to be in certain, social media outlets that are negative and scary. To create a positive outcome is very important for the brain to continue further healthy development. So, and I would say again, simple conversation. Sit next to the child, make child comfortable. As a parents, we are the one who are responsible for the safety. Making like kids do rely on us. So be calm, sit next to the child. Invite to start conversation. First, listen about the kid's experience, and then try, as I said previously, create more positive.
Dr. A, that's so helpful, and that's so helpful, so practical, to be able to, like you said, sit with them and speak with them. Can you talk about something that I think so many of us can use help on this? What are some signs or something that we should look out for in our kids to show maybe they're facing trauma, maybe they're really struggling after experiencing this, whether it be on TV or whether they were there?
Yes, it's a very good question. So trauma, sometimes the manifestation of trauma could be very, very subtle. The most important question, how your child is different from the previous baseline. If you start noticing that kid is more sad, withdraws from the, doesn't want to see friends, feels scared, tearful. Some kids will experience more anger, and they may present as kids who are very oppositional. So kids who struggle to fall asleep, kids who, having nightmares, everything that is in general very different from child's previous functioning level should warrant some further conversation. So never be shy to seek help, to see help from professionals. It's very, very important to talk through. We may help child not to end up with a long-term, post-traumatic stress disorder by being providing timely help, timely psychological help.
Thanks, Dr. A. So we know this because we report on it every day in Chicago, but gun violence seems to be a very, very huge topic here. It happens every day. Are there any long-term impacts on children who grow up surrounded by this kind of trauma?
Absolutely. Trauma shapes us as humans, right? So people who are exposed in traumatic events, even the brain structure changes when kids are exposed to trauma since early childhood. It absolutely shapes, the way person see the world. It is sad that it happens, but I hope, things will be better.
We hope so too. Dr. A, one thing we know is just like kids, we talk about these topics, but so many adults struggle with tragic events too. Yeah. So I'd love to know if you can speak directly to parents or guardians out there who see their kids struggle, but they might also be struggling in the wake of this Highland Park shooting.
Absolutely. One part of being a child psychiatrist, child and adolescent psychiatrist, we work close with parents. The kid does not exist as a isolated, person. Family is extremely important. Talking with parents are very important. I can't even imagine what they're going through. I think the scariest probably emotion is feeling helpless and don't know what to do and how to help. That was the reason I mentioned for parents it's important to take care of themselves. Whenever I would see parents struggle, I absolutely would suggest further counseling and help. It's, kids do depend on parents.
And I also wanted to ask, Sometimes you think that you have to be there experiencing a tragedy firsthand to experience trauma from it. Can you just address that? Because maybe people are watching on TV, or maybe they live in the area, or they live in the north suburbs. Can you just talk about that maybe secondhand experience?
Absolutely. It may have exactly the same impact if someone witnessed the death or, something horrible happened to other person. Kids are very impressionable, but it actually may happen also to adults as well. So to witness a death is as traumatic as, and witness not necessarily being at the scene. In our modern world, it knocked right, into our homes. So like seeing this all on TV, extremely traumatizing. And it happens frequent, and it creates a sense of insecurity and fear, and absolutely may trigger signs of trauma.
Well, thank you so much, Dr. A. Some very important advice and tips, especially in the wake of this tragedy in Highland Park.